Hey, FluentEars family, welcome back. You're listening to the FluentEars English Podcast, the place where learning English feels like a real conversation, not a boring lesson.
Yes, and today is exciting because this is episode 14 of our real-life conversation playlist. But this episode is also part of our medical English playlist, where we focus on English used in hospitals, clinics, and medical settings.
That's right. If you've listened to episode 13, you know we walked into a hospital together and practiced conversations at the reception, with the nurse, with the doctor, and even at the billing counter.
Exactly. Episode 13 showed you how to survive in a hospital with simple English. But today, in episode 14a, we'll go deeper. We'll learn medical English vocabulary, words that doctors, nurses, and patients use in real life.
And don't forget, if you're also following our spoken English playlist, that's where we share tips to sound fluent and natural in everyday conversations. Combine that with today's lesson, and you'll be ready for both daily English and professional English.
So, in this first part, episode 14a, we'll cover three big areas. 1. Medical terminology foundations. 2. Body systems vocabulary. 3. Symptoms and conditions.
By the end, you'll have a strong foundation of medical vocabulary, and you'll also learn how to use it in real conversations. Let's get started.
Okay, Emma, let's start with the basics. Medical English often looks scary because of the big, complicated words.
Yes, like gastroenterology or hypertension. But here's the secret. Most medical words are built from Latin or Greek roots, plus prefixes and suffixes. Once you understand the building blocks, you can guess the meaning of new words.
Let's break it down. A prefix comes at the beginning of a word and changes its meaning. A suffix comes at the end and usually shows the condition or process.
And the root is the main part of the word, usually about a body part or system.
Okay, let's look at some useful prefixes in medical English. Hyper means too much or above normal. Hypo means too little or below normal. Cardio means related to the heart. Neuro means related to nerves or the brain. Gastro means related to the stomach. Derm or dermato means related to skin.
Here is how they work. Take hypertension. Hyper means too much and tension means pressure. So hypertension means high blood pressure.
Or hypoglycemia. Hypo means too little. Glyc means sugar, and emia means blood condition. So hypoglycemia means too little sugar in the blood.
Exactly. So if you know the building blocks, you can understand difficult words without needing to memorize them.
Now, let us add suffixes. Here are some important ones. Itis means inflammation, such as swelling, redness, or pain. Example, arthritis means inflammation of joints. Ology means the study of. Example, cardiology means the study of the heart. Ectomy means surgical removal. Example, appendectomy means removal of the appendix. Pathy means disease. Example, neuropathy means disease of nerves. Emia means a blood condition. Example, anemia means low red blood cells.
So if a doctor says you might need a tonsillectomy, do not panic. Just break it down. Tonsil means tonsils, and ectomy means removal. It means surgery to remove your tonsils.
Doctor, you said I have gastritis. What does that mean?
Sure, let me explain. Gastro means stomach, and itis means inflammation. So gastritis means your stomach lining is irritated or inflamed.
See? By breaking it into parts, you understand it easily.
Before we move on, let's learn a couple of idioms that are useful when talking about learning difficult subjects like medicine. 1. Rule of thumb. A general principle based on practice, not exact science. Example, a good rule of thumb is to drink enough water every day. 2. Learn the ropes. to understand the basics of something. Example, as a new nurse, she is still learning the ropes.
These idioms are not medical, but you'll hear them when teachers, doctors, or trainers explain things.
Okay, FluentEars family, let's practice. I'll give you a word and you try to guess its meaning. 1. Dermatology. 2. Hypothermia. 3. Carditis.
Pause the podcast if you need time. Ready?
Dermatology means the study of skin. Hypothermia means too little heat in the body, which is a dangerously low temperature. Carditis means inflammation of the heart.
Great job! Now you're learning to decode medical words like a professional.
Remember, the goal is not to memorize thousands of medical terms. The goal is to understand the system so you can feel confident when you hear them.
Yes, even if you don't remember every word, you'll understand the meaning from the parts. That's powerful.
Now that you know the foundations of medical terminology, let's move into body systems vocabulary. Doctors often organize knowledge by body systems.
Yes, like the circulatory system, respiratory system, digestive system, and nervous system. Learning vocabulary this way is practical, because when you visit a doctor, they usually focus on one system at a time.
The circulatory system is about your heart, blood, and blood vessels. Important words include: artery means a blood vessel that carries blood away from the heart. Vein means a blood vessel that carries blood back to the heart. Pulse means the beating of your heart that you can feel in your wrist or neck. Blood pressure means the force of blood against the walls of your arteries. ECG, also called electrocardiogram, means a test to check the electrical activity of your heart.
Here's a doctor-patient conversation.
Doctor, I feel my heart racing sometimes.
That's called a rapid pulse. We'll check your blood pressure and maybe do an ECG to understand your heart's rhythm.
Notice the phrase heart racing. That's a natural way to describe a fast heartbeat. The doctor then used technical words: pulse, blood pressure, ECG.
Now the respiratory system is all about breathing. Key vocabulary includes: lungs are the main organs of breathing. Trachea means the windpipe, or the tube that carries air to your lungs. Asthma is a condition that makes breathing difficult. Shortness of breath means difficulty in breathing. Oxygen mask is a device to help a patient breathe.
Here's a sample dialogue at the hospital.
Are you experiencing any shortness of breath?
Yes, especially when I climb stairs.
All right. The doctor may order a lung function test.
The phrase shortness of breath is very common in hospitals. Patients often say, "I can't catch my breath," and nurses use the phrase lung function test. The digestive system is about your stomach, intestines, and digestion. Key vocabulary: stomach is the organ that digests food. Intestines are the tubes that absorb food and water. Liver is the organ that helps clean the blood and digest fat. Diarrhea means very loose and frequent stools. Constipation means difficulty passing stools. Acid reflux happens when stomach acid moves up into the throat and causes burning.
Let's role play.
What seems to be the problem?
I often feel burning in my chest after meals.
That sounds like acid reflux. I'll give you medicine to reduce stomach acid.
See how the patient described the problem in simple words? Burning in the chest. And the doctor gave the medical term, acid reflux. Now the nervous system is all about the brain, spinal cord, and nerves. Important vocabulary. Brain is the control center of the body. Spinal cord is a bundle of nerves inside your back. Numbness means loss of feeling. Tingling means a pins and needles sensation. Seizure means sudden uncontrolled electrical activity in the brain. Migraine means a strong headache, often with nausea or light sensitivity.
Here's a hospital dialogue.
I feel tingling in my hands.
That could be a nerve issue. We'll check your spinal cord and do some tests. Notice the everyday description. Tingling. The doctor connects it to a possible medical cause. Nerve issue.
Okay, let's relax with some idioms that use body vocabulary. 1. Have a change of heart. To change your opinion or decision. Example: the patient didn't want surgery at first, but then had a change of heart. 2. A gut feeling. An instinct or intuition. Example: the doctor had a gut feeling something was wrong, even before the tests. 3. Nerve-wracking. Very stressful. Example: waiting for test results is nerve-wracking.
These idioms connect English learning with real life. They make you sound more fluent. Let's review quickly. I'll say the system, and you try to remember one word. Circulatory system. Artery, vein, pulse. Respiratory system. Lungs, shortness of breath. Digestive system. Stomach, acid reflux, constipation. Nervous system. Brain, tingling, migraine.
Great work! The more you practice, the faster these words will become natural.
So far, we've learned medical word parts and the main body systems. Now let's focus on something very practical: symptoms and conditions.
Yes, this is important because when you visit a hospital, the first thing the doctor or nurse asks is, "What are your symptoms?" If you can describe them in clear English, you'll get help faster.
Here are some very common symptom words. Fever, higher than normal body temperature. Chills, feeling cold, often with shivering. Cough, forcing air out of the lungs suddenly. Cold, runny nose, sneezing, sometimes sore throat. Flu, similar to a cold but stronger, often with body aches and fever. Fatigue, extreme tiredness. Dizziness, feeling like you might fall or the room is spinning. Nausea, feeling like you want to vomit. Vomiting, actually throwing up food/liquid from the stomach.
Notice how some of these symptoms are everyday words, like fever and cough, while others, like fatigue and nausea, sound more formal or medical.
Can you tell me your main symptoms?
I've had a fever and chills for 2 days. I also feel very tired.
Okay, please take a seat. The doctor will call you shortly.
See how the patient simply listed symptoms? Fever, chills, tired. That's natural English in hospitals. Here are some useful words. Sharp pain. Strong, sudden pain like a knife. Dull pain. Steady but not very strong. Throbbing pain. Comes and goes like a heartbeat. Burning pain. Feels like fire or acid. Cramping pain. Tight, squeezing pain, often in the stomach. Stabbing pain. Sudden and very sharp.
Here's a dialogue. Can you describe the pain?
It's a sharp, stabbing pain in my lower back.
Okay, we'll order some tests to check for kidney stones. Notice how the patient gave both the type of pain, sharp, stabbing, and the location, lower back. That's very helpful for doctors.
Now, let's look at some external conditions you can describe. Rash, red spots or irritation on the skin. Swelling, when part of the body becomes bigger due to fluid or injury. Bruise, purple/blue skin after hitting something. Cut/wound, open injury in the skin. Scar, mark left after a wound heals.
Here's an example. Why are you here today?
I have swelling in my ankle after playing football.
All right, we'll get an X-ray to make sure it isn't broken.
The patient didn't need fancy vocabulary, just swelling in my ankle is enough for the nurse to understand.
Now let's talk about some common conditions that patients often report. Diabetes, high blood sugar, hypertension, high blood pressure, asthma, difficulty breathing, arthritis, inflammation of the joints, allergy, reaction to food, pollen or medicine. Infection, when bacteria or viruses make the body sick.
Notice how many of these words come from Greek or Latin. That's why learning prefixes and suffixes helps. For example, arthritis means arthro, joint, plus itis, inflammation.
Now let's add some idioms that people use when talking about health. 1. Under the weather. Feeling sick. Example, I'm a bit under the weather, so I won't come to work today. 2. On the mend. Recovering. Example, she had surgery last week, but she's on the mend now. 3. Back on your feet. Fully recovered. Example, after 2 weeks of rest, he's back on his feet. 4. Catch a cold. Become sick with a common cold. Example, if you don't wear a jacket, you'll catch a cold. Do you have any other symptoms besides fever?
Yes, I've had a cough and sometimes chest pain.
All right. Do you smoke?
No, I don't.
Good. The doctor may check for infection in your lungs. This short dialogue shows how nurses ask about symptoms and lifestyle factors like smoking.
Sometimes the words change when talking to children or elderly patients. Doctors use simpler phrases.
For example, instead of nausea, doctors often say, feeling sick to your stomach with children. Instead of fatigue, they may say, tired all the time.
Here's a dialogue with a parent. My child keeps coughing at night and has trouble breathing.
That sounds like asthma. We'll give him an inhaler to help his lungs. See how the doctor used the simple word help his lungs instead of technical terms?
Okay, FluentEars family, let's practice again. I'll give you a symptom, and you try to say it in medical English. Stomach feels like fire. Head hurts badly with light sensitivity. Cold, shaking feeling. So we go. 1. Burning pain/acid reflux. 2. Migraine. 3. Chills.
Good job! You're learning to describe symptoms clearly.
When you talk to doctors, you don't need to sound like a medical dictionary. Just describe what you feel, where you feel it, and how long you've had it.
Yes, for example, I've had a throbbing headache for 2 days. That's enough information for a doctor to start. So let's quickly recap what we covered in this episode 14A. 1. Medical terminology foundations. Prefixes, suffixes, and roots, like itis, cardio, neuro. 2. Body systems vocabulary. Circulatory, respiratory, digestive, and nervous system words with dialogues. 3. Symptoms and conditions. Fever, cough, pain vocabulary, rash, swelling, common diseases, and idioms.
And remember, this episode is part of both the Real Life Conversation playlist and the Medical English playlist. If you want to sound more fluent in everyday English too, check out our Spoken English playlist.
In episode 14B, we'll move to doctor-patient conversations and the hospital environment. That's where you'll practice full dialogues in real-life scenarios.
Until then, keep practicing. Don't just memorize. Use these words in real conversations. That's how your English will grow stronger.
And remember, good health and good English are both lifelong journeys. See you in the next episode.